Welcome everyone to the HDC Chat Speaking Series, where we host speakers and guests from around the world to share their experiences and groundbreaking insights at the convergence of healthcare and digital innovation. Today, we have the privilege to have Dr. Balcezak from Yale New Haven Health joining us today. Thank you, Dr. Balcezak.
Thank you. You can call me Tom.
Thank you, Tom. And you can call me Rashida, please. Let me provide a short bio of Tom. He is the Executive Vice President and Chief Clinical Officer for Yale New Haven Health. Over the course of his career, he has transformed the clinical enterprise around the core concepts of high reliability, aligned operational and clinical care processes across the growing geographics of Yale New Haven Health. He also built exceptional teams dedicated to accelerating the creation of signature care across the academic health system. Again, thank you for joining us today. I have a couple of questions to enrich our students and our audience. I'm going to start with the one pertaining to high reliability. Okay. Your bio mentioned that you have transformed clinical enterprise around the concepts of high reliability. How do you see AI enhancing the principles of high reliability in patient care? And if you can share some illustrative examples, that would be great.
Sure. So, the concept, first of all, let's talk about the concept of high reliability. And the concept of high reliability is that it is possible, in fact, it has been demonstrated in many industries that you can work in a very high risk environment and have near zero errors. And there are many environments, nuclear power, the nuclear submarine industry, aircraft carriers, et cetera, where it has been demonstrated that, these folks take care of their work and they are able to engineer out the fact that we are fallible as humans. And we have to acknowledge that, is that we make errors. We will never be 100% reliable. However, there need to be systems of care that allow us to deliver on our work in an almost flawless way. So, with that acknowledgement, with that idea that we ourselves are flawed, but we must aim for a perfect work environment, there need to be tools and systems that we can apply in order to make sure that that system of care, in the case of a healthcare environment, is perfect. And that's really been, an acknowledgement. It goes all the way back to some work done by Wyke and Sutcliffe at the University of Michigan. And it's been widely adopted into aviation many years ago and now into healthcare. And so there has been, for many years, a hope that technology and other things would bring the outcomes of high reliability, that is, perfect outcome with almost no risk of failure, into the healthcare environment. And certainly all of us who've experienced healthcare would hope that for ourselves and our loved ones. And those of us that are delivering healthcare would hope it for their actions. No one goes to work in healthcare with the idea that they are going to harm someone. And so all the way back to the year 2000, when computerized physician order entry and electronic medical record was for most of us just a hope and a dream, we had this idea that those were kinds of technologies that would help reduce diagnostic errors, prescribing errors, therapeutic errors, and they have. But with this new advent of AI, our hope is that we can overlay onto all that digital information, some people call it digital exhaust, that comes out of the healthcare environment, both mechanisms to assess what's going on, predict what might happen, and prevent what we don't want to have happen. And there are some examples already that we've been able to overlay into healthcare to try to, really make good on this promise that we are going to drive medical errors, diagnostic errors to zero.
That's wonderful, and that's really the hope whenever we have access or we go to a hospital or a healthcare facility. My next question, which you alluded to, is As part or a key of your work, it has been aligning operational and clinical care processes across multiple locations within Yale New Haven health system. Where do you see AI playing the most transformative role in standardizing this alignment between operation and clinical processes, optimizing care in a growing healthcare system such as Yale New Haven Health?
I think, we started out, I started out in my career before there was anything such as a health system, certainly not an integrated health system. This was back in the days where there were individual hospitals and we all had paper-based medical records. And over the last 30 years, we've evolved into integrated health systems that share information, have an integrated electronic medical record, and are beginning to put into place similar operating systems at each one of those organizations, even across different health systems. A few years ago, at this point, it was probably many years ago, Atul Gawande, I think it was, wrote that article about the Cheesecake Factory in the Atlantic magazine. And his interest was, how do we standardize medicine in a way that the Cheesecake Factory has standardized the restaurant menu? And that caught a lot of people's attention all those years ago when it was written, because the idea is, medicine its roots are in a guild where everyone does it similarly, yet not exactly the same. But we are rapidly migrating to what we're calling a care signature, meaning that if you come into any one of our locations, you should expect that the processes are the same, the approach to the diagnostic and therapeutic treatment is the same, and the outcomes are equivalent. In fact, we published a paper after the COVID epidemic demonstrating that because of our care signature work, because of our implementation of standard processes across all of our institutions, all 7 of our campuses, we had nearly the best mortality rate of any institutions in America, and there was no variation across any of our sites. So no matter what site you accessed, you got the same protocols, the same care, and it drove those outcomes. And since that time, now almost 5 years ago, we have instituted these care signature pathways in thousands of clinical conditions. And those are layered on with AI tools, whether they be AI tools in the picking up of lesions on x-rays, or the AI tools that we use in order to detect early clinical deterioration on patients so that we can intervene earlier. And these have been very useful. And we're really only just at the very beginning of applying these tools that should help us drive standardization even further beyond the simple structures and processes that we've done to date. Things like a similar the same electronic medical record, the same pharmacy formulary, the same protocols for how CT scans are obtained, and so forth and so on. And then if we can continue to drive that standardization, the mantra of Six Sigma is you reduce the variation and then you can move the dial any which way you want. So if we can continue to reduce that variation, we can control the outcomes of those processes and really drive towards much better, improved, and standardized care.
Tom, you provided so many insight. I'm trying to chart all those key elements. I probably have to revisit and review this recording to grasp all the insights you're sharing, and I'm sure my students and others will do the same. I love the example of the cheesecake or cheesecake factory. And at this point, almost every person can access a slice of cheesecake or a bite of cheesecake. But for others, it may be costly still around the world. I had the pleasure of traveling to several countries, and the idea of hospital systems is just starting to emerge in many areas around the world. And you added several key aspects again in this space. My next question related to that slice of cheesecake is about the cost. Cost is a major concern for every hospital and every hospital system around the world. how can AI be leveraged to reduce those healthcare expenses and at the same time improving patient outcome?
I have a couple of thoughts. One is that we have done a terrible job as a nation so far in controlling costs. I think most of your students probably know that healthcare is a GDP hog in the United States. We're up to 18, I think it is 18% of the GDP. And there's no book anywhere that says, the correct percentage of the GDP that healthcare should be in a particular country is X. But the problem is once you get to a high percentage, and at any percentage, what is being spent on healthcare isn't available to be spent on housing and food and education. And at some point, healthcare can't continue to grow as a percentage of the gross domestic product. So we have an imperative locally, because we want to be efficient, but also nationally and internationally to control costs. So what do we need to do? Well, what we need to do, I think, should be informed by what hasn't worked. And what hasn't worked is nearly everything that we have done so far, because it continues to grow in expense. Healthcare, to my knowledge, is the only industry that, as we get technological advances, as we improve in our ability to apply additional computer speed, additional knowledge, additional mechanization, the price goes up. If you think about every other industry, the assembly line, for example, in manufacturing, ATMs and computerization of banking, the use of technology in the transportation industries, all of those innovations made it more accessible for consumers and drove the price down and improved the experience. In healthcare, quality has improved, outcomes and lifespan for the treatment of sick patients has improved. But as most people have seen, the lifespan of individuals, particularly in the United States, has shrunk over time, and the cost has gone up. So what are we getting wrong? Well, I think that's something we need to think about. And I think we need to focus on what exactly are we asking for as a population, as a nation, and internationally for outcomes. I could argue that we in the United States have an outstanding sick care system, but what we don't have is a very high quality, low cost healthcare system that takes care of everyone. And so I think the answer to your question is different depending on what we want as an outcome, because much of the rest of the world has put much more effort, energy, and investment in the totality of a healthcare system, and not focused on the sick care system that we've created in the United States. And what I mean by a sick care system is, if you have a devastating illness, there is nowhere in the world you want to be except the United States. However, if you look at infant mortality, you look at prevention and social determinants, the United States does not measure up to much of the rest of the world. So I think the answer is different depending on what your expectation is. So, I think that whatever your challenge is based on your region, and whatever your desired outcome as a population, continued embracement of technology applied correctly is going to have to be part of the answer.
Thank you again for your insights. I'm going to do a follow-up question, if I may. Healthcare is known to have many stakeholders that make it work, from clinicians to technicians to operational folks. And it has been known that each have their own, I'm going to put between quotes, language, and nobody wants to speak the other person's language. That's leading to a lot of disconnect between those stakeholders that are impacting the patients. I also understand that most, if not all, healthcare systems are moving from fee for service to value care, right? So how, with all the achievements that Yale Hospital is doing, how are you making these different entities talk to each other to achieve the greatness that you're sharing and that we know for fact?
Yeah, let me try to weave that together. I think, you said two things. One is that, we've got some silos in healthcare. And some of those silos are in healthcare, and some of those silos are in healthcare, and then what I would call healthcare adjacent spaces. And we need to do better to make sure for our patients and our communities that we link together and make sure that we're addressing all of our patients and communities' needs. And linked to that is, I think, I think it's a product of the concerns that people are raising about healthcare being too expensive, meaning how do we focus on value? How do we make sure that our communities and patients are getting value out of the dollars that are being spent in healthcare? And there's this concept, as you mentioned, of population health, meaning let's pay for outcomes, let's pay for populations rather than the traditional fee for service, as you mentioned. So you can link those two and say, if we together want to evolve our payment systems, our reward systems, if you will, and incent a different set of outcomes, right? Not just more volume of surgeries and hospitalizations, but better outcomes for patients, then I think it creates the imperative that we break down those silos so that we can work together, so that take a couple of different examples. A patient with spinal trouble, back pain. Well, in the traditional fee-for-service model, there's an incentive to go to surgery because there's an additional payment there. In a population health model, there's an incentive to try physical therapy first and some other strategies. But we need to be able to work together and align the incentive systems so that we go through and treat the patients in our communities as efficiently as possible. So I'm hopeful that as we continue to say, let's move towards a different reward system because our patients and communities are asking us to, then perhaps there's a way that we can use that as an incentive to align the different groups, the stuff that's within healthcare and also with what's healthcare adjacent. Because look, a healthier population that returns to work more quickly benefits everyone. It's not just the healthcare space, right? It's the employment space. If you ask any employer today of any stripe, they'll tell you that keeping a healthy, active, engaged workforce is harder today than it's ever been, right? If you talk to communities, elected officials, these folks are elected and put in positions of power to help their communities. And one of the things that's sort of foundational, it's on the bottom tier of Maslow's hierarchy of need, is we need people to be healthy and happy. And, that comes from living their best lives, which, we all should be focused on. So they're incented to make sure that our healthcare system is delivering the maximum outcome of healthy patients living long and productive lives.
It seems, if I understood that correctly, we're moving from a reactive healthcare to more of preventative care, correct?
I think it's both preventative, but also making sure that the patients who receive care receive it in the most efficient way and focused on maximizing the best outcome available for that patient. And sometimes in extreme examples, this is why you're seeing the growth of palliative care and hospice, because sometimes, there are conditions near the end of life that they're simply doing more is not better for the patient. But we should be focused strictly on that patient's quality of life and comfort. So that's also, it's not just preventative, it's also at the other end of the healthcare journey or the lifespan, if you will.
My last question, you're providing us with great insight. I'm going to move to AI, AI readiness and workforce, which you alluded a bit, but from the other angle that all employers, they want healthy population, but now within hospital and hospital systems, AI and automation are transforming the way healthcare professionals work. And on that, I have a big shout out to a colleague. Her name is Dr. Tamila Trentoro, whose research is focusing on the future of work. So back to you as a leader in the clinical and healthcare space, what advice, what insights would you like to share with clinicians with medical students, with data scientists working in this space, that on how they can harness this convergence between AI and healthcare to augment, not to replace clinical decision making.
You know, I think that the folks that are in your class, the future generations that are coming up, that are going to be replacing all of us as we retire, are going to have a very different set of experiences than I and my colleagues have had, because those tools are now going to be available. And I think technology will continue to become a larger and larger part in the delivery of healthcare, as will AI. And some of it is very obvious. Already, some of the applications are quite obvious, and some of the applications of AI in healthcare are going to just run behind the scenes. I'll give you a couple of examples. You know, we have an ambient listening technology that we use in the clinical space now, where physicians used to have to take a history, examine a patient, and then sit down originally when I first started with a piece of paper and a pencil and a pen and write it all out so that it was noted for the patient and for the medical record and for billing. Now, with ambient technology, it listens and it creates a note. And it's saved clinicians enormous amounts of time, making them more productive in their work lives much better. There's another example where I talked about clinical deterioration. Well, we all know that patients that are in hospital sometimes can get worse in their clinical course of care, and we need to intervene. Well, we now have AI systems that run in the background that continuously monitor those patients' vital signs, their clinical activity, their intake and outputs, their lab data, and it synthesizes it all real time. As every data point is put into that patient's medical record, it synthesizes a score, and it does alert our clinical staff for who might have an early deterioration, so they can prioritize their work and see those patients earlier. Radiologists, both here and many other locations, are having x-rays read by an AI program and highlighting areas that the physician, the radiologist, can look at and either confirm or deny whether or not this patient has a problem. So, you know, I look at the just last few years of how AI has made it in these and many, many other ways into healthcare, and it makes me think about the early 2000s when across the country, it was only beginning to have electronic medical records across the United States. Now, you'd be very hard-pressed to find an institution that doesn't have an electronic medical record. Virtually no one is on a paper-based medical record anymore. But what is interesting is, having watched this over the last 30 years, the physicians generationally have changed. And in the very early days of the electronic medical record, it was very hard for those physicians to make the adaptive change from paper to electronic. But today, the physicians that are coming out and the other clinicians, nurses, pharmacists, physical therapists, et cetera, their whole life has been an interface with technology. And if we tried to go back to a paper-based medical record, they couldn't do it. They function beautifully in the electronic medical record, and it has really helped care. And I think AI is going to be similar, which is those of us now who are only seeing the beginnings of how AI can impact healthcare, the delivery of healthcare and outcomes, it's going to become a whole nother ballgame generationally as folks that have more ability to use the tools, understanding of them, strengths and weaknesses, and frankly, folks who have the insight in how to develop new and better tools to solve problems that we don't even know we have.
Indeed. The more insights you give me, the more questions, but I'm mindful of your time. You mentioned that as technology is evolving, we cannot go back to the paper records. I had the honor of running a master workshop that is to healthcare executives and also clinicians. And within the first 15 minutes, the clinician, he was a surgeon, approached me and he said, Rashida, I don't think AI, I don't think I need AI while performing a surgery. This is not helping me in any way possible. This was the first 15 minutes of a 3-hour workshop or masterclass. Within less than an hour, he approached me again. He said, "Oh, I see it. It's helping me. It's helping me and my team be able to predict what the tools I need, what medication I need in case something can happen." And he went and elaborated a little bit more that benefited me understanding how I could deliver better those master classes, but it changed his mind how he could leverage. And that aligns what you were saying, but I just thought I'll share this from a data scientist rather than clinician point of view.
Yeah, I mean, again, there are problems we may not even realize we have. So for example, in the old days, surgeons would open up a patient's abdomen and perform the surgery with their hands, with their fingers. So the amount of tension they were putting on something, how hard they were pulling was immediately available to them because they felt it. Now, many surgeries are being done by robot. The physician is seated at a console that's on the other side of the room as the patient and directing that robot, those arms on how to open, cut, pull, tie, repair. And they've lost the haptics. They've lost the ability to feel exactly how that is. Maybe AI can help with that. Maybe AI can give them that feedback that they currently don't have. I don't know. I'm not a surgeon and I'm certainly not an AI expert, but these are challenges that we know are there and that maybe AI can help. And there are thousands and thousands of others. And we're only at the dawn of this age.
You are a clinician and you're also a leader within healthcare as well. How do you see, again, I'm elaborating based on your responses, how do you see the ethical issues that may arise from, especially in the clinical side, probably less at the operational level? What that type of ethical issues you have encountered or you foresee happening as AI is being embedded more and more in care, in providing care for patients?
Yeah, that's a great question. I think that is something that we need to keep our eyes and ears incredibly focused on. And I think there are ethical issues, there are security issues, cybersecurity issues. And with regard to the ethics, I think it's not going to change. I don't think it's going to change our focus on what is ethical in healthcare, right? It's respect for the individual, respect for the autonomy, privacy, etc. I don't think those principles will change. I think how we protect the patient's privacy, how we protect, the patient-physician relationship, those things are going to need to be very carefully evaluated. There is concern that, we talk about, for example, in clinical studies, there's been a lot of work in research clinical studies to make sure the patient's anonymity is protected. Well, some people have said, with AI, there's no such thing as anonymity because if you de-identify someone, you can always find enough data points to re-identify them. Now that opens up all kinds of ethical concerns that, for example, one small area that we're going to need to focus on. With AI and generated models, how do you know you're talking to me right now? Maybe I've uploaded a video and you're talking to a large language model that has used a simulated set of my voice, my words, and my image, and I'm not actually sitting in this chair. You're talking to a hologram that is being run by a computer. That's possible. And in 20 years, it's going to be much, much more likely. It's likely, it's possible now, but how do we protect against that? So, in a clinical environment, we need to make sure that if you are spending time with me, it's actually me. It's not some synthetic version of me generated by an AI bot. All these things need to be figured out.
Am I actually talking to Tom right now?
Trust me, I'm not sophisticated enough and I don't have those tools at my disposal to create any AI version. And I'm sure the world wouldn't want an AI version of me.
That's wonderful. I always try to conclude our interviews with something that is light. And in that regard, Are there any concluding insights at the convergence of healthcare and AI that you, or any items that we didn't talk about that are important to share in closing?
I would say the only thing is, I always love talking to and with students because they are the future. And I would only say that we are only at the very beginning. And it is, one thing that throughout my career that I've always marveled at is how innovative, excited, energetic the students can be. And I encourage them to take a hard look at how the future should look and then work hard towards working in that direction, because it is in their hands. And this dawn of this new age with AI is going to transform everything, not just healthcare, but everything. And if you're taking this course because you're interested in healthcare, great. And I think what I'm saying about healthcare applies to virtually every other part of industry. It's going to have a huge impact. And I hope that, we harness this responsibly and we use it for good purposes for our communities and patients.
Thank you so much, Tom. Thank you for your insight. Thank you for you as a person, and thank you for representing Yale New Haven Health. Thank you so much.
Well, thank you. It was fun talking to you.
Pleasure.